Up next on Live It Up, it's Eugene Antenucci, Dr. Eugene Antenucci. He is a dentist and he's phenomenal. Welcome to the show. How are you?
I'm happy to be here. I'm doing well.
Wow. We know each other because I produced one of your first early commercials.
Way back.
Way back. And was very impressed, if you will, with all of your expertise and your skills. And one thing that I learned just recently is that you were in the Air Force. I didn't know that.
I started in the Air Force after dental school. Yeah, 3 years.
Okay.
As a captain.
Okay. And so how many mouths do you think you've helped?
Oh, I
Close to 1 million?
many mouths.
Many smiles.
Many
smiles. What made you decide to choose that as a profession?
Dentistry.
Yeah.
Long road got me there, but one of the health professions. I grew up with my father being a physician and always wanted to do something where I'm helping people in terms of helping their health. And just so happened my neighbor, when I was in high school making decisions, he was a dentist. He had a nice house. He was off on Saturday. My father was out delivering babies. I said, not a bad idea. So,
there you go, because OB/GYN is 24/7, but a dentist, you can set some hours.
Yes, set some hours, yeah.
Great, good for you. So you started out, and you started out in your own practice, or were you part of another practice in the beginning?
After the Air Force, I came back to Long Island. I was in California, came to New York, and bought a practice at a home office, and grew that to the point where I needed to get a bigger place. Built a building in Huntington, grew that, and it got not out of control, but it got out of the realm of what I enjoyed, because it was bigger than what I wanted.
Understood.
So I sold that to my partners. I had purchased a practice in Bayshore, and have been building that up, and I decided to sell my share in Huntington and Bayshore full-time.
So quality of life, being able to give a more one-on-one kind of
That's really what I'm able
service
to do right
to
now.
your patients, your clients, right? So, like you said, it grew as big as you could possibly want it to be, but it missed the essence of you really having that interaction?
It became not me, which is what happened. It took a life of its own, and that life of its own was now led by other personalities, which are great personalities, but it wasn't anymore me. And when you start to question enjoying what you do, you start to say, you know what, life is about enjoying what you do.
And one of the reasons I reached out to you and I invited you to come on is that I saw something that you posted on social media about seniors and you know, dental care and wellness, if you will. And a lot of times, a lot of disease is caused because people have not taken care of their teeth, and they don't understand that there's a correlation between that.
There's a big correlation. People don't understand the very close relationship between oral health and overall physical health. You know, age happens. I mean, we can't help it. You know, we have this wonderful gift that we have, which is life, and we share that. But with life comes periods of life and times of life, and each time has its own set of challenges and needs. And when you look at the older population of people, as people age,
including us, because I have known you a while, right?
In that realm,
starting to turn.
There are changes that occur that aren't bad, but they are there, and they have to be made peace with, and you have to understand them to remain healthy. And the changes in the oral cavity aren't as easy to hide as many other changes in the body. They happen. They're like a roof blowing off of a house or a window breaking. Something's there physically has to be fixed.
Okay.
There are so many different aspects of dentistry, but some of them are to the point where something actually breaks or something's falling out.
That's what I was going to ask you. When you roll your tongue across your teeth, if you actually feel like a physical change in your gum or your tooth, is that like, what are some of the warning signs? How could somebody like look at their smile and say, you know what, this tooth is loose? Like,
well,
what are the indicators, I guess?
Our bodies are smart, and many people are self-aware of their bodies and of changes. So changes in size of your gums, if your tongue is feeling something that's different today than that was there yesterday, most likely there's something not right, because things don't happen and change that quickly.
Okay.
So there could be swelling of some kind, which could be caused by gum disease or problems like that, or it could be caused by an allergy of food that you ate. There's many different factors. could be caused by something lodged underneath the gums.
Like an old popcorn kernel that you can't floss out, right?
Yes, or flossing too hard could cause. So there's something that you feel. So your body tells you that. There are tastes and odors that come from disease in the mouth, or it could be from a cavity, which is just collecting all sorts of bacteria, and it so much collects that it starts to taste funny, or people tell you, you know what, your breath smells a little off, and there's
like
something. Yeah,
halitosis,
please,
too much.
Go back from you. But there are changes that you're aware of. So those types of things that happen all of a sudden are acute, or they're something that's need immediate attention, or that immediately are changing. There's some things are chronic, like gum disease is a chronic condition that happens slowly, little by little, but as it snowballs, you get lots of bacteria in your mouth that cause lots of changes, can cause swelling of the gums, can cause a malodor in the mouth, can cause a funny taste in the mouth, can cause, you can put your tongue against your tooth and it's a little wiggly today where it wasn't yesterday or the day before.
See me doing that right now with you? Dr. Eugene, I'm like, let's check these things.
Tooth back here. No, but those are the types of things that are more evident. They're easier to see and to deal, not always to deal with, but to see and to diagnose.
Okay.
As we age, there's lots of troubles and lots of problems that happen because not only are we dealing with physical changes in our mouths, the wear and tear that happens in your 50s, 60s, and 70s and 80s where things are physically breaking down, but there's also your body that you're dealing with. So you go to the doctor and he tells you you have high blood pressure and gives you these pills and tells you your heart is doing this funny and gives you these pills and now you're taking vitamins for this and that. And those medicines have an effect on, can have a potential effect on your oral health.
Interesting.
If you have diabetes, there's a big effect on your oral health.
Okay.
So there's an effect that that can deal with gum disease and different problems, or propensity to get decay in your mouth and problems.
Or even I had a friend that had thyroid cancer, and because of the radiations, she started losing her teeth.
Oh yeah.
Right,
Well,
but it was years after it had been
because of the
radiated.
radiation damage has an effect on the way that the bone cells grow, how they divide and they grow, and they over time can cause problems with that. It's called osteonecrosis for a big word, but it's basically what you described. There are medicines. Many women today are on medications that help their bones to be stronger. But these types of medicines have also been found for some reason to cause problems when you extract a tooth, and they've been on heavy doses of these medicines, the bone doesn't heal anymore. So there's problems like that, and that usually is seen in a more elderly individual. There are problems with people as they get older. I have many patients who are dealing with parents that are suffering from dementia of one type or another, and they don't care for themselves as well. So
They
now you
forget
have an
to brush their
individual
teeth, right? Or they
who
just, right.
doesn't have the dexterity or the remembrance of brushing their teeth, or if I asked a child to clean a window, they wouldn't do as good a job as well as I would clean it, and the attention. If you ask someone who has dementia or who has Parkinson's disease and their hands are moving and they don't have the dexterity to brush, they're not going to do as well as they should. And that's taken for granted or an account. Maybe they didn't do as well as they should have all their lives. So there are many, many factors, plus the medicines these people take. So we're piling on to what our bodies do with external factors that make it a challenge, more of a challenge.
And you're there, though. You're there to help them. You're there to consult with them, and right, they could come in and make an appointment with you, and
that's basically, it's one of the things. It's like when you're a parent, you don't get the manual of how to be a parent. When you go to dental school, they don't really teach you. Part of you're dealing with kids, but there's no, and that's pediatric dentistry, but there's no geriatric dentistry per se. There's no specialty in dentistry. It's something that we learn along the way, and we learn from reading and understanding how these drugs mix together and affect a person. How to help a 50-year-old with a 75-year-old parent who has Parkinson's disease and is having trouble, or who may have recently broken their hip and they're having trouble, they're not ambulatory anymore. So how do we help care for these people? What do we do for them? They're falling apart, and their mouths they're missing teeth, and they're having trouble chewing, and their denture doesn't fit, and they lost weight, so it doesn't hold in anymore. Do we do major work on them, or how do we treat them, and how do we help them to be comfortable? What's too old today? There are many, many questions that I grapple with,
yes,
and issues that I grapple with to do the best for my patients, but I see the struggles of my patients who are dealing with their families, and I see the struggles of, I just had a man in the chair today. He's in his mid-90s. Was a professor in a local college, a very, very brilliant man. He's been a patient for 25 to 30 years.
Wow.
And today I walked in the room and he was sleeping in the chair, and he woke up as soon as I came. And you look at him and you say, wow, you know, life is wonderful, but life is tough. You know, and he has a caretaker and his family's taking care of him, but that's a job. You know, you get rid of your kids, send them off to school, and you got mom and dad that you're going to start thinking of, and it's a consideration.
Well, I thank you for spending some time with us and
It was my
talking about
pleasure.
some of the things that that age and that population are dealing with. And it's nice to know that you are there, that you care, and that you're willing to help people. So,
thank you.
Dr. Antenucci, thank you very much
Thank
for
you for
joining
having me.
us.
Thank you.
If you find yourself needing somebody that has the warmth, the care, and the compassion that Dr. Antenucci has, please reach out to him today. Thanks for watching. Live It Up.